Dr. A.C. Shanmugam, the Chief Patron, Founder and Chancellor of Dr. MGR Education and Research Institute, Dr. A.C.S. Arun Kumar, Patron and Vice President of Dr. MGR Educational and Research Institute, Srimati Lalita Lakshmi A.C. Shanmugam, Managing Trustee of Sri Lanka Educational Trust, Dr. S. Vijayanand, Executive Director, Rajarajeshwari Group of Institutions.
Light takes away darkness, symbolizes wisdom and knowledge.
Students or delegates.
Seminars, laboratory information system, workshops and seminars on electrophoresis in myeloma, artificial intelligence in laboratory medicine, mindfulness in laboratory medicine, Sigma, metric, as IPS, management tool. So then,
my thesis topic was substrate for anti-nuclear antibody, right, which is an immunology test. I had to look for a substrate, and at that time the substrate used was rat liver. So I had to sacrifice the rat, take out the liver, cut frozen sections, and add the serum onto that to understand if the patient had anti-nuclear antibodies. My thesis was to compare rat liver substrate and HEP2 cells as a substrate. And it was very clear that the HEP2 cells were far more sensitive and specific. So the idea is this, that the how of pathology is going to change, and we need to embrace it. From the time the cell counters we have used in 90s to what it is today is immensely different. We would only look at hemoglobin total count and platelet count, and we would not look at the histograms. I was fortunate to come when the last paper was being presented. The histogram, the scatter plots, the flags were very rudimentary. They were hardly there. From then on to what we have today. So, will AI replace pathologists and radiologists? Definitely not. But pathologists and radiologists with AI knowledge will replace pathologists and radiologists without AI knowledge. So be aware and use the current situation of incorporating technology in a way that it makes sense to you and more importantly to the patient. If you have to do a mitotic count on a slide that is very complex, we can do it, certainly, there's no doubt about it. But can we get the technology to do it for us, and we validate the technology?